Welcome to the patient diagnostic simulation. You need to examine the patient and diagnose his illness. You will use visual prompts on the monitor for probing the patient. Make sure to turn on the microphone before asking questions to the patient. Next, you will be shown the vitals of your patient. These are the vitals recorded by the medical assistant of your patient. BP 98/70ths, HR 110, RR 28, 102.2 Fahrenheit. Now, you can begin with your diagnosis.
Hi, how are you doing?
I've felt terrible the past few days and I've got this horrible cough.
Are you coughing up any phlegm?
Yes, I've been coughing up this reddish-colored gunk.
Do you have any stomach pain?
No, that's not a problem.
Have you got any chest pain?
Yes, my right chest is sore. I can't seem to take a deep breath without it hurting.
Have you had a fever or chill?
Yes, I took my temperature last night and it was 103. I've had the shakes and chills and my body aches.
Do you have any medication allergies?
No, I don't have any allergies.
How long have you had the cough?
Around 2 days.
You have completed all the questions, so you can proceed further.
Do you mind if I do a physical exam?
Okay.
Do. Using the mouse cursor, left-click on the highlighted circles on the patient's body to get the results. You recorded an SpO2 of 93%. Abdominal auscultation results are normal. Respirations mildly labored. Raunchy and coarse crackles are present in upper right lung fields. Rapid rate and regular rhythm, no murmurs, rubs, gallops, or heaves. Upper right lobe with dullness to percussion. Shoddy non-tender anterior cervical adenopathy. No nuchal rigidity. Eye exam results are normal. Ear exam results are normal.
I'm done with the physical exam now. We can proceed to your treatment plan.
Okay.
I think you have a pneumonia.
Okay. That doesn't sound good.
I would like you to get a chest x-ray.
Okay, I can do that.
Well done. It is a good idea to get a chest X-ray to confirm your suspicions.
I'm going to prescribe you some antibiotics.
Okay.
Well done. This patient likely has pneumonia and needs to start antibiotics immediately. This is the end of the dialogue demo.